The Levo system works with acoustic stimulation at the tinnitus frequency. And so we work hard to match that tinnitus frequency. And then while the patient is sleeping, it is going to be just covering over the tinnitus. And then we do a tinnitus evaluation that helps to suggest whether the patient has what's called residual inhibition. So when that acoustic stimulation occurs, often a patient will report that when it stops, the stimulation, their tinnitus is reduced in perception. And so that is what I find when you do the Levo system acoustic stimulation treatment, that often then the benefit is a reduction in the perception of tinnitus that next day. And then as you use it more and more, it can be more long-term.